How common are CSF leaks after endoscopic brain surgery? Imagine undergoing a procedure to remove a brain tumor through your nose and then facing a leak of cerebrospinal fluid, the clear fluid surrounding your brain and spinal cord. While that might sound concerning, it's important to know how often this actually happens and what it means. Cerebrospinal fluid leaks are a recognized complication after endoscopic brain surgery, especially when surgeons use an approach called endoscopic endonasal surgery to treat tumors like pituitary adenomas, craniopharyngiomas, meningiomas, and chordomas. The good news is that the occurrence of these leaks is relatively low, generally ranging from about 3 to 10%, depending on the specific case and surgical factors. A review of 360 patients who had endoscopic endonasal surgery found that about 3.9% experienced a cerebrospinal fluid leak after their procedure. Most of these leaks needed to be repaired using additional endoscopic techniques, and some patients required repeat repairs. Factors that increased the risk included tumors located in the suprasellar region, which is near the base of the brain, tumors that invaded the space around the brain, and cases where there was a high flow of cerebrospinal fluid during surgery. Using advanced reconstruction methods, like a vascularized nasostal flap, has been shown to protect against leaks, especially in higher-risk situations. Looking at broader data, studies and meta-analyses of transsphenoidal surgeries, which are common endoscopic procedures to remove pituitary tumors, report leak rates around 3.4 to 5% in adults. Earlier studies showed higher rates, around 7.5 to 10.5%, but improvements in surgical techniques, better visualization during surgery, and the routine use of tissue flaps to close the skull base have helped reduce these numbers over time. Certain tumors are associated with higher leak rates. Larger or more invasive tumors like craniopharyngiomas and some meningiomas tend to have higher postoperative leak rates, sometimes reaching 20% or more. For example, patients with craniopharyngiomas have shown leak rates around 20.8%, compared to about 5% for smaller pituitary adenomas. The presence of a cerebrospinal fluid leak during surgery also increases the chance of a leak afterward. Higher body mass index or being overweight can also be a risk factor for leaks. The likelihood of a cerebrospinal fluid leak varies depending on the tumor type and location. For example, during transsphenoidal surgery for pituitary tumors, leaks can range from very rare to as high as 17%. For tumors located higher up near the brain's base, like craniopharyngiomas or certain meningiomas, leak rates can be as high as 33% in some cases. Thanks to advances in skull base reconstruction, especially the use of vascularized tissue flaps, the rates of cerebrospinal fluid leaks have decreased significantly. Sometimes, surgeons may use a lumbar drain after surgery to help reduce pressure and prevent leaks, but this isn't always necessary. Understanding the risk of cerebrospinal fluid leaks is important because, if they are not managed properly, they can lead to infections like meningitis or other complications that can affect recovery. Surgeons work carefully to minimize this risk through meticulous surgical techniques, careful patient selection, and effective reconstruction methods. If you are considering endoscopic brain surgery, it's essential to discuss your specific risks with your neurosurgeon, especially based on your tumor size, location, and other health factors. Recognizing and treating leaks early helps ensure the best possible outcome and reduces the chance of serious complications.